Good evening, one and all. Welcome to the webinar today from wherever you're joining us. My name is Preeta Harikrishnan, and I'm the Deputy Manager, Department of Admissions, Amrita Health Sciences, Kochi campus. Thank you for joining us today as we present to you a talk on career as a physician assistant, its strengths and future. Before that, let me introduce you to our guest for today, Mr. Prasad VG Sir, Assistant Professor at Center for Allied Health Sciences, Amrita School of Medicine. Mr. Prasad Sir has completed his PG diploma as physician assistant in 2005 and his MSc in Allied Health Sciences as physician assistant with core training in gastrointestinal surgery and solid organ transplantation in 2009. He is an active member in the liver transplant team. His specific contribution includes the starting up of the deceased donor program in the region. Apart from his clinical practice, he was involved in 11 multinational clinical trials as the department's clinical research coordinator. He's a member of the organizing committee for several national level conferences. In addition to his teaching responsibilities, he is a program coordinator for Allied Health Sciences of the Amrita Vishwavidyapita University. He's an executive council member of Indian Association of Physician Assistants and president of Indian Association of Physician Assistants, Kerala chapter. He's a member in the Curriculum Task Force Committee formed by the Government of India for developing the proposed Allied Health Science Council. So I welcome you, sir, to address our viewers today. Prasad, sir.
Thank you, madam. Thank you. Can you hear me?
Yes, I can.
Okay. Thank you, madam, for the wonderful introduction. Can I share my screen?
Sure.
Okay. Okay, is that visible?
Yes.
Okay, thank you. Namaskar to all attendees, the future students of Amrita PA program, and any parents are joining, welcome. This a small presentation on the career aspects of a physician assistant and the current trends and the future prospects. The physician assistant, you might have heard this name because this program or this profession was started around 20 years back in Kerala. This is a relatively new profession to the healthcare system in India. So it is very important to know the future prospects of this profession before you select a course as your higher education. So today's agenda will be who is a physician assistant and what is their role in the healthcare delivery, and what are the job profile, what are the duties they are delivering, and their education and training while in the undergraduate or in the postgraduate or in the doctoral program. What is the education they are getting or the clinical training they are getting, and their career pathways in which are all the fields they can specialize and they can progress their career, and the current opportunities, and a few details on the Amrita PA program. So as an introduction, a career in medicine or in a healthcare profession is a dream for all students. So is doctor and a nurse is the only personnel working in a healthcare setting. Previously, we aware that it's only the healthcare delivery is dependent upon only doctors and nurses. Very recently, or this allied health science profession is introduced, and there are a lot of professions that is developed or being developed in the healthcare delivery. So as the technology advanced, the technology came into the medicine or the healthcare delivery also. So that is how all these allied health science professions develop. Now it is not an individual practice. It is a team-based practice in the healthcare delivery. So that is why all these professions are very important. So the first question is, do you want to work like a doctor? So there is a profession called physician assistant. They are the mid-level healthcare providers, or now the recent terminology is advanced practice providers. Actually, this concept developed in United States, America, and it's spread across the world. Now, in almost all countries, the physician assistant or its analogs are working in the healthcare delivery. So they are the middle level providers in the healthcare delivery. So who is a physician assistant? A physician assistant or an associate. Now the government of India has changed the title from physician assistant to associate. Now recently in America also they have changed the title to physician associate. It's a type of mid-level healthcare providers. Physician assistants will be working in between nurses and doctors. They are working interdependently with physicians. PAs provide diagnostic and therapeutic patient care in all medical specialties and in all settings. So the interdependence, that is the important point. So they can work with under the supervision of a physician or a surgeon. So the job profile in the clinical setting, they work in all medical and surgical specialties. You might have heard about cardiology, gastroenterology, endocrinology, neurology. There are so lot of specialties in the healthcare delivery or in a hospital setting. So they will be working in all medical and surgical specialties. They conduct interviews, they take medical history of a patient, and they do the physical examination. They can order and interpret the diagnostic test, and they can diagnose the illness and formulate a plan and coordinate the patient care and manage the patient care and perform medical procedures, help in prescribing the medications, and the clinical research. That is a very vast area in healthcare. So they work in clinical research and provide patient counseling. This is very, very important. Patient counseling. They work in, they bridge in between the patient and the doctor. Patient counseling is very, very important. And preventive health, again, that is also a very vast area. We always hear prevention is better than cure. So the preventive health, that is a very vast area. And of course, in the surgery, they will assist. So coming to the education, the entry level program is an undergraduate program that is a 4-year UG program, that is BSc, Bachelor of Science in Physician Assistant. It is a 3-year plus 1-year internship. So 3 years is studentship and 1 year is internship. So your final year examination will be at the end of 3rd year, and after that there will be a internship. And in post-graduation, it is a Master of Science in Physician Assistant. It's a 2-year program in different specialties like cardiology, cardiothoracic surgery, pulmonology, gastroenterology, geriatrics, all these specialties. And doctoral degree, it's a part-time and full-time. Part-time is 3 years and full part-time is 5 years and full-time is 3 years. So these are the education options. Entry level is undergraduate. And coming to the undergraduate training, it's a medical model. The training is in the medical model, and the training will be given in a medical college. And the first year, it's all the basic science subjects like anatomy, physiology, and all. And second year, it's a pathology, pharmacology, and all the broad specialty departments and its training. Third year, they will be getting training in the other departments like emergency medicine, pediatrics, all those things. And fourth year, it will be an internship either in the specialty or in primary care. So this is the education pattern of UG 4-year program. So the career pathway can be two types. It's a clinical or non-clinical. So coming to the clinical, it's a specialty practice. As I said earlier, these are the few specialty departments in a hospital. So they can work in any of these specialties. And all these specialties, our Amrita PA students are placed across Kerala or in India. I'm not reading the names. And in the non-clinical, if you are specializing in a non-clinical area, this can be administration, administrative, pharmaceutical companies, they can specialize, biotechnology, medical device companies, medical writing. So this is also a specialty area they can focus, medical writing. EMR specialist, this is electronic medical records. So as a EMR consultant, they can specialize. A lot of our alumni is specialized in the EMR, and in academics, in the teaching, they can specialize, medical informatics, and of course in the research. So coming to why Amrita, so that was a basic introduction about PA profession and its training. Why Amrita? Why you should choose Amrita for your PA studies? So this image you can see, this is the headquarters of the Amrita Vishwavidyapeetham University. It's a highlight of the ranking of Amrita Vishwavidyapeetham. It's a NAC A++. That's the highest grade in the NAC accreditation. It's a NAC A++ accreditation. And from the government of India, it's the 5th best university in India and the #1 private university in India. You might have already known this. Coming to the campus, the health science campus, the program is conducted in Amrita School of Medicine. And this right side bottom picture, you can see this is the campus. And it's a very big hospital. So one of the biggest hospital in Kerala or India is attached. This medical college is attached to, and you will be getting training in this Amrita hospital. So coming to the faculty, showing the pictures of few faculties, only head of the departments. So you will be training under this renowned faculty members. Coming to the training, the peculiarity of the PA program is it's a student-centric methods, experiential learning, and hands-on training. You will be given a lot of opportunities for the hands-on training, on-job training, and individual attention. Each student will get individual attention, and all these training classrooms, the clinical area, everything is ICT enabled, and there are a lot of emphasis is given on skill development, because that is the newer trend. The skill development is very, very important. And this is a simulation center. Before you get posted in a clinical area, before you go to the patient interaction, you will be trained in the simulation center. So all these patient interactions, will be simulated in the simulation center, and you will be get adequate training before you go to the actual patient area. You will have postings in OP departments, wards, ICUs, and you will be posted along with senior doctors and senior staffs, so that you will get adequate mentoring and adequate training in your skills and competencies. This physical infrastructure, few images as shown. These are the infrastructure facilities available in the clinical area, hospitals. These are all advanced machines. You will be getting trained in these clinical areas. It's a portable CT machine. These are all 3D printing technology. All these things are very advanced technology. This is CyberKnife and robotic surgery. All these clinical areas you will be getting exposure and training. And coming to the national level contribution of Amrita PA program, it's the national curriculum for the physician assistant. In 2015, there was a meeting from the government of India, and this curriculum was framed at our institute. And this curriculum is accepted by the government of India, and it is implemented all colleges in India. And apart from the academics and the clinical training, we give other value added addition also to the students. There's a few pictures on international conference. We regularly conduct international conferences, symposiums, workshops, everything, so that our students get a lot of opportunities to learn on the newer trends in their respective fields. So there's a few pictures on the internationalization. We regularly arrange expert talk series, and the second picture, the Madhura Varshini. Madhura Varshini is doing an internship now. She got a position as a director of interpersonal exchange in the international organization. So she was our student. So this kind of exposure they get when they are as a student. In the studentship itself, they get opportunities like this, and they can interact with world leaders and faculties and other students in other countries, so that their networking opportunities are very huge. This is skill development. So a lot of emphasis is given on the skill development. This soft skill development. Soft skills are very important in a healthcare setting. So there are separate sessions and programs for the soft skill development, and students are given a lot of opportunities to develop the soft skills during their studentship, so that they can perform well in their respective clinical areas. These are the few workshops we conduct regularly for our students. Regularly, we conduct seminars, and world-renowned faculties will interact with our students. Coming to the another area, this outreach centers. Amrita has 6 or 7 outreach centers in the rural areas. So the students will get posting in the rural outreach centers, so that they can go to the community, and they can have an understanding how the community health and public health, all these implementation of various government projects, and how the community care is delivered, so that their outlook on the healthcare delivery is completely improved. And so this is a very good initiative by the Amrita PA program, the community outreach. These are the few pictures on the medical camps and other community activities. And few pictures on the general campus facilities like lecture hall, examination hall, and a huge central medical library, and auditoriums and seminar halls. All these areas are accessible to the students. And one slide on our alumni. The program was started in 2002. All our alumni are placed not only in India, abroad also in various continents. They are well placed, and they give a very good feedback on the training and the opportunity they get from the physician assistant training. So welcome to the PA profession, a PA training program. If you are very compassionate to the patients that you are going to meet, and if you are a good communicator, if you are a good communicator, and you should be very sensitive. All these patients and their families are coming to a hospital with a lot of problems, so you should be very sensitive, and definitely you should be hard worker. Not only in the physician assistant, any healthcare setting, any healthcare profession, you should be very hardworking. Otherwise, you will not become successful. And critical thing, the flexible, willing to work with a team. Now the healthcare delivery is a teamwork, so you should be able to work with a team. So if you have these qualities, definitely you can very well opt this profession. I am sure that you will enjoy the training in Amrita, and you can shape your career future with this selecting this profession. Thank you very much.
Thank you, Prasad sir, for that excellent presentation. The slides were really wonderful. All those who have joined today would have really benefited from what you had really given to them, suggested in so many different ways what Amrita is and why Amrita is so in demand today. The slides that you have showed will really attract most of the students. If they have decided some other course, they'll surely come to PAT. That's what we can understand from today's slide and your presentation too. Thank you for all of that.
Thank you.
So, and now let me welcome Shanley of admissions to give us some information on the admission procedure this year. Shanley.
Thank you, ma'am. Good evening, all. I am Shanley from Admission Office, Amrita Institute of Medical Sciences, Kochi campus. So I am here to give a brief explanation of the admission procedure for BSc Physician Assistant. So the duration of the program is 4 years, including 1 year compulsory internship. We have 30 seats. The eligibility will be minimum 17 years of age and maximum 23 years of age on or before 31st December 2023. The student should pass in +2 with 60% aggregate marks in physics, chemistry, biology, and English. Admission to various undergraduate and integrated programs in Amrita University is through 4 different entrance examinations conducted by the university. The first one will be for engineering, second one physical sciences, third one life science, agriculture and medical sciences, fourth one behavioral sciences. Students who wish to join the BSc Physician Assistant course can write Amrita entrance examination, life sciences, agricultural and medical sciences, that is AEEL. So regarding the entrance examination details, Amrita entrance examination will be of 2 hours with a number of 80 questions. Later on, based on the ranking, students will be called for the counseling. Mode of examination will be like multiple choice type, and we will be giving 4 options as possible answers. Candidate can choose the most appropriate answer for each question in the computer-based test mode. 3 marks are awarded for each correct answer and -1 for each wrong answer. So the pattern will be physics, chemistry, biology, English, whereas 75 marks for each physics, chemistry, and biology, and English will be of 15 marks. The syllabus for the AWEL 2023 is given in the website. I'll just copy the website ID. You can check the website information handbook and you'll be getting the syllabus, which is purely based on the +1, +2. So candidates can register giving their preference of the course, mode, etc. in the registration portal. So I'll be copying the registration portal ID here. So if you are not registered, you can register yourself using this link. So the registration fees will be 750 rupees. The candidates are advised to have their own personal and valid email ID and mobile number. The candidates are advised to retain the registered mobile number and email ID they have submitted in the application form till all the admission procedures are completed, as all important updates will be informed to the candidates through SMS or email or both. So the admission procedure includes the following steps. First, you have to register with your email ID and password. Later on, you have to fill the personal information. Then second one will be the application, and third one, the academic details. Fourth one, payment, and finally, upload the documents. So the registration portal will remain open for a duration of 2 months. Registered candidates will be later on informed regarding the examination date and the examination center. So for any admission related query, kindly go through the contact details mentioned in the website, or you can mail your queries to the email ID which I am providing right now. So BSc Physician Assistant, we have 3 categories: merit, non-scholarship, NRI. So in merit category, per year tuition fee will be 1,50,000. In non-scholarship or the management category, it will be 2 lakhs per year. And in NRI category, it is $3,000. And there will be another fees of around 40,000. Not exactly, around 40,000. And hostel and mess will be 68,000. That's it. If you have any doubts regarding the registration process, you can just mail to ugsadmissions@aims.amrita.edu. Thank you. Over to you, ma'am.
Thank you, Shanley, for giving that detailed description. I think it's mostly clear with them. And then I think if you have any more doubts, you could go into that website, which Shanley has given there, amrita.edu/admissions. And there are also the phone numbers on which you can contact through the website also. So I think this was a wonderful webinar we had so far. And thank you, Prasad sir, for that. Thank you all for joining once again. But Prasad sir, may I have a query with you? Like if the students have completed their BSc PA and physician assistant course, could they join for any of the programs that they have in the MSc physician assistant?
Yes, they can. BSc Physician Assistant is a generalized training.
Okay.
They will get training in the basic science in the first year, and broad specialty in the second year, and super specialty in the third year. And there is an internship also.
Okay.
So they can choose any specialty in their postgraduate training.
Okay. So that's also very clear now. Thank you so much, one and all, for joining this webinar today. Thank you all once again. So let us wind up the webinar today. Thank you.
Thank you, ma'am. Thank you.